Captain Sarah Chen had spent 4 years at Fort Meridian Medical Training Center without drawing attention to herself. A quiet instructor in the trauma simulation lab, known for her precise corrections and her habit of staying late to clean equipment no one else touched. The recruits called her thorough. The senior staff called her reliable. No one asked why her hands sometimes trembled during live-fire medical drills, or why she insisted on protocols that seemed excessive, or why her eyes held the weight of someone who'd already seen worst-case scenarios become everyday reality. Then, Deputy Director Colonel Marcus Venn arrived to observe a training exercise, and Sarah made a choice that would unravel everything she'd spent years protecting. During a simulated mass casualty scenario, Venn corrected her in front of 30 recruits, overruling her triage assessment, insisting that protocol demanded a different approach to a critically wounded dummy patient. Sarah had seen that protocol fail before. She'd held a soldier's hand while it happened, and in that moment, with Venn's authority radiating through the room and recruits watching to see if they should memorize his words instead of hers, she did what protocol forbade. She respectfully contradicted him, explained the flaw in his assessment, and demonstrated with clinical precision why her approach saved lives and his didn't. The room went silent. Venn's face hardened, and within hours, an investigation began. What no one expected was that the truth behind that confrontation would reach far beyond a training facility, far beyond a single career, and into the classified records of a woman who had been running from her own ghosts since the day she came home from Kandahar, unable to forget the faces of the soldiers she couldn't save. Chapter 1. The Weight of Routine. The fluorescent lights hummed their eternal 3 a.m. song, even though it was 7:15 in the morning. Sarah had always hated that sound, the way it seemed to pierce through skull bone and settle directly against the brain. She stood in the equipment room at Fort Meridian Medical Training Center, methodically checking each IV line, each tourniquet, each chest seal. The rubber gloves snapped against her wrists with familiar precision. 17 years since her last deployment, 14 since she'd hung up her medic patches and decided that teaching would be quieter. That routine would heal her. She was wrong about the healing part, but the routine had worked. Every morning, arrive at 600, check equipment, prepare simulation rooms, brief afternoon instructors, stay until 1900 to ensure everything was catalogued, sanitized, stored. No variations, no risks. No one had to know that the woman arranging IV bags had once kept a soldier's femoral artery from bleeding out in the back of a Humvee with nothing but a combat application tourniquet and a prayer she didn't believe in anymore. The simulation lab was her kingdom precisely because it demanded nothing but precision. Dummies didn't bleed real blood. Scenarios didn't end with a flag-draped coffin. Nothing in this room carried the weight of an actual human life, until Colonel Venn walked in. He was the Deputy Director of Training Operations, a man with a pristine career, 0 deployment experience, and a reputation for efficiency. He'd sent a memorandum the day before, observing all live-fire medical exercises, ensuring protocols met updated standards. Sarah had read the memo twice, then returned to her methodical routine. Venn entered the simulation room at 14:30, exactly when Sarah had scheduled the exercise. 30 recruits in Stage 1 trauma response, a mass casualty drill simulating an IED strike on a convoy. Sarah played the role of scenario controller. She called out vital signs, introduced complications, demanded rapid decision-making under pressure. It was the most important lesson recruits learned, that speed without accuracy killed people faster than hesitation. One recruit, Lieutenant Marcus Torres, sharp-eyed and cautious, was assigned a critically wounded dummy, unstable vitals, massive abdominal bleeding, chest trauma. According to current protocol, Torres should have prioritized hemorrhage control, then immediate evacuation. Standard approach, standard result. Sarah watched Ven nod approvingly as Torres began the textbook sequence. But something flickered in her chest, an old instinct, the voice of a medic who'd learned on actual patients instead of mannequins. The dummy's chest trauma was too severe. Evacuation wouldn't work. The patient would code during transport. And if Torres didn't address the airway compromise first, all the hemorrhage control in the world wouldn't matter. She let the scenario play out anyway. Watched Torres follow protocol perfectly. Watched the dummy's vital signs crash. Watched a recruit learn that following rules wasn't the same as saving lives. Ven was already making a note on his clipboard. Sarah felt something crack open inside her chest, the careful compartment where she kept the memories of soldiers who died while she was doing everything right. She raised her hand. "Pause the scenario," she said. Her voice sounded steady. "Good." Ven looked up, eyebrow raised. A man not accustomed to interruption. "Sir, I'd like to walk the recruits through an alternative assessment. Current protocol doesn't account for the severity of the thoracic injury in this case." "The protocol is clear," Ven said. "It wasn't a dismissal. It was a wall." Sarah stood very still. She could feel 30 pairs of eyes moving between her and the colonel. She could feel her own heartbeat, loud and irregular, like it was trying to escape her ribs. This was the moment. This was where she chose between safety and truth. She chose truth. "With respect, sir, protocol fails here. The airway compromise is primary. Hemorrhage control is secondary. If we evacuate without addressing the breathing obstruction, this patient codes within 4 minutes. The dummy's designed to simulate that outcome. I've seen it happen in the field. I'm suggesting we show the recruits what actually saves this life." The silence was absolute. Even the fluorescent lights seemed to hold their hum. Ven's jaw tightened. "Show them," he said. A challenge. Not permission. Sarah moved to the dummy, gloved hands steady despite the way her pulse thundered in her throat. She worked through the assessment. Clinical, methodical, explaining each decision. She addressed the airway first, then the hemorrhage, then evacuation. The vital signs stabilized. The dummy lived. When she finished, she didn't look at Ven. She looked at Torres, at the other recruits. At the recruits who suddenly understood that they didn't have to choose between following orders and saving lives. Sometimes you could do both. Sometimes you had to risk everything to find the middle ground. "Let's reset," she said. "Again, until every one of you can do this without thinking." That night, lying in her small apartment 6 miles from the base, Sarah knew. She knew the moment she'd chosen to speak, she'd chosen to be seen. And being seen meant someone would eventually ask why a simulation instructor knew field medicine so precisely. Why her hands didn't shake during the scenario. They only shook afterward, in the quiet equipment room, when no one was watching her fall apart. Someone would ask, and Sarah didn't know if she was ready to answer. Chapter 2. The investigation begins. The next morning, Sarah found a notice in her mailbox. Report to Colonel James Hartford, Director of Personnel Review, at 1,000 hours. No explanation, no context. Just the institutional coldness of a military bureaucracy that had decided to look at something it had been trained to ignore. She arrived at Hartford's office in dress uniform, pressed, precise, armor. Hartford was older, grey at the temples, with the look of someone who'd spent a career sorting through other people's problems and learning to care less about each one. "Captain Chen," he gestured to a chair. "Close the door." She did. "Colonel Ven filed a report yesterday about an incident in the simulation lab. He says you contradicted him in front of recruits, challenged protocol, undermined his authority." Hartford's eyes were steady, but not unkind. "That's serious. You understand?" "I understand it sounds that way," Sarah said. "The scenario required a modified assessment. I still believe, that the current protocol had a flaw. I demonstrated the alternative, in front of a visiting deputy director. Yes, sir. Hartford leaned back in his chair. It creaked. Tell me something, Captain. Where did you learn field medicine? Your file says you completed standard medic training, but your assessment in that scenario was tactical, specific, like you'd practiced it under real pressure. There it was. The question she'd been waiting for since the moment she'd opened her mouth in front of Torres and 30 recruits, and one deputy director with a pristine file and zero tolerance for uncertainty. I'm a capable instructor, Sarah said carefully. That's not an answer. It's the answer I'm required to give, sir. Hartford studied her for a long moment. Then he opened the file on his desk. Sarah could see her name typed across the top. Her file, everything the army had recorded about Captain Sarah Chen, and mixed in with the paperwork, she caught fragments of words, deployment records, commendation notes, something stamped classified across it like a scar. You were in Kandahar, Hartford said. It wasn't a question. Attached to Special Operations Medical Unit. That's why the precise field assessment. That's why you knew protocol didn't work in that scenario. Sarah's throat tightened. Your clearance was revoked 8 years ago, Hartford continued. Not for misconduct, for psychological evaluation, recommended by your CO at the time. You got a medical discharge, civilian status, and apparently you've spent the last 8 years working in a training facility where no one asked questions. I've done my job well, Sarah said. I'm not disputing that. Hartford closed the file. But Colonel Venn is disputing your judgment. He's recommending a full review of your protocols, your teaching methods, everything you've implemented here. He's also asking why a person with your background is being trusted with recruit training without extensive oversight. Because I care about keeping people alive. I believe that, Hartford said, and he sounded like he meant it. But caring isn't enough in the military, Captain. Loyalty is, and right now your loyalty is in question. You publicly corrected a superior officer. You embarrassed him in front of junior personnel. That doesn't go away quietly. Sarah felt something settle in her chest. The cold clarity that came with knowing the choice had been made, and now there was only the consequence. What happens now? She asked. Now? An investigation. They'll interview the recruits, review your teaching records, ask questions about your time before the discharge. Someone, probably Venn, will want to know if there's a psychological reason you questioned authority. They'll look for instability, questionable judgment, anything to justify pulling your clearance again or ending your career here. And you? Hartford stood, walked to the window. Rain was beginning to fall outside, soft and relentless. I'm going to do what I always do. I'm going to look at the file. I'm going to try to figure out if you're a problem or a conscience, and I'm going to wait for something else to happen, because it always does. People don't usually get this complicated unless there's more to the story. Chapter 3. The Crack in the System. 3 days into the investigation, something happened that changed the trajectory of everything. A recruit named David Okonkwo collapsed during a field exercise. Heat exhaustion initially, then seizures, then complete cardiovascular collapse in the back of a transport vehicle en route to St. Helena General Hospital. Sarah got the call at 17:30 hours. Colonel Hartford, voice clipped and urgent. I need you at the hospital now. Okonkwo's the recruit from your simulation lab. The mass casualty scenario. He's critical. The doctors are having trouble stabilizing him, and I'm being asked for background on his training exposure. I need someone who can advise on whether he had prior medical complications we should have screened for. Sarah was in her car within 5 minutes. St. Helena General's trauma ward smelled like every other hospital Sarah had ever been in. Antiseptic, blood, the metallic undercurrent of fear. She found Hartford in the observation area outside Trauma Bay 3. Behind the glass, a team of physicians and nurses moved with controlled urgency around David Okonkwo, 23 years old, sharp eyes, The recruit who'd listened carefully during her simulation lessons, who'd asked questions about alternatives to protocol, who'd understood that real medicine happened in the spaces where textbooks ended. He was unconscious. His body was seizing, controlled by medication, but visible in the tension of his limbs, the way his monitors flickered with the electrical storm inside his brain. "What happened?" Sarah asked. A trauma surgeon named Dr. Patricia Mendez joined them, exhausted, focused, carrying the particular weight of someone who'd been fighting the same patient for hours. Heat-related injury initially, but his metabolic panel is showing something else. Elevated enzymes, liver compromise, something systemic. We can't pinpoint the cause, and we're running out of time before the seizures cause permanent damage. Medical history, Sarah asked. Clean, standard recruit physical 8 weeks ago. Sarah watched Okonkwo's vital signs trace across the monitors, and something in the pattern, the specific combination of symptoms, the timeline, triggered a memory. Not a recent one, not from her teaching experience, from before, from Kandahar, from a soldier named Marcus who'd had similar seizures after being exposed to contaminated water during a mission. Marcus, who'd recovered once they'd identified the rare parasitic infection most medics wouldn't think to test for, because it didn't fit the standard American disease profile. She turned to Dr. Mendez. "Has anyone screened for parasitic infection, specifically waterborne parasites?" Mendez frowned. "There's no indication of—" "The recruit did field water collection training 2 weeks ago," Sarah interrupted. "Simulated contaminated water sources. I was there. He was thorough, but if there was a breach in protocol—" "Water collection training doesn't use actual contaminated water," Mendez said, gently, like she was speaking to someone who'd lost perspective. "It does, if someone wasn't paying attention to the training materials," Sarah said. "If someone used water from a retention pond instead of the standard training solution, and if that water was carrying something that sits dormant for weeks before causing acute neurological symptoms." "That's a massive assumption," Mendez said. But Hartford was already on his phone, calling back to the base. And 3 hours later, when they'd tested the retention pond water and found evidence of parasitic contamination, and when they'd started Okonkwo on the correct anti-parasitic treatment, the seizures began to stop, slowly, then steadily, then completely. 18 hours later, David Okonkwo woke up, confused, exhausted, but conscious. Alive! And Sarah was standing in the observation window when Dr. Mendez came out of the trauma bay and found her. "You saved his life," Mendez said. "Your diagnosis, your memory of the field training. That's why you knew." Sarah didn't respond. She was watching Okonkwo's hand move slightly on the bed, a small, involuntary gesture that meant his nervous system was reorienting itself to consciousness. He was going to be okay. But something else was happening too, something quieter but just as significant. By evening, the story had spread through St. Helena General. The army captain who'd diagnosed a contaminated water source, the trainer who'd known exactly what to look for because she'd seen it before, because she'd served in a theater where parasitic infections were as common as the sand, because she'd brought her hidden expertise into a moment where it mattered. And by the next morning, Colonel Venn's complaint about her challenging authority had been quietly buried under a different kind of investigation. This one about the training protocols he'd implemented. This one about the cutbacks he'd made to water safety testing. This one about a deputy director with credentials, but no field experience making decisions that had nearly killed a recruit. Comment where you're watching from. Let's see how far the stories of real courage and silent sacrifice can travel. Chapter 4. Exposure. The second investigation was faster, quieter, and infinitely more thorough than the first. Within a week, they'd traced the contaminated water back to a cost-cutting measure Venn had implemented during his tenure, reducing the frequency of water source testing in field training areas from monthly to quarterly. The retention pond that should have been regularly monitored had been left untouched for 4 months. By the time Okonkwo collected water from it, parasitic growth had reached dangerous levels. Ven's response was predictable. He claimed the testing schedule had been approved by his predecessors, that the contamination was unprecedented, that one incident didn't invalidate an otherwise sound program. But Sarah knew something else had happened. In the process of investigating the contamination, someone, probably Hartford, had dug deeper into her file, into her actual background, into the part of her record that had been classified, carefully filed away, attached to a psychological evaluation that recommended separation from active duty. She received a summons to Hartford's office on a Thursday afternoon. This time, he wasn't alone. Major Elizabeth Sanchez sat across from Hartford's desk. She wore the insignia of the Army Medical Corps and carried herself with the particular authority of someone who'd spent years evaluating other people's decisions. She introduced herself as a senior medical advisor and asked Sarah to walk her through the morning she'd diagnosed David Okonkwo. Sarah did, precisely, clinically, without emotional embellishment. "Your knowledge of parasitic complications is remarkably specific," Sanchez said, "especially for someone whose official background is standard medic training." "I was thorough in my studies," Sarah said. "You were deployed in Kandahar with a Special Operations Medical Unit," Sanchez said. "It wasn't a question. That clearance was revoked 8 years ago, but your medical knowledge, the things you've been teaching recruits, suggest you retained significant operational expertise. That expertise just saved a recruit's life. And it suggests that your psychological discharge might not have been about capability." The room was very quiet. Hartford let the silence stretch. "My discharge was recommended by my commanding officer," Sarah said carefully, "for my own well-being." "After what incident?" Sanchez asked. Sarah thought about lying, about deflecting, about retreating back into the safe, quiet instructor persona she'd spent years constructing. She thought about David Okonkwo waking up in that hospital bed. "I lost someone," Sarah said, "during a patrol in Kandahar, a colleague. The diagnosis was missed because the protocol didn't account for rare parasitic infections in that theater. I was with her when—" She stopped, restarted. "My CO recommended discharge because I was becoming fixated on non-standard diagnoses. He said I was chasing ghosts. He said the hypervigilance was compromising my judgment." Sanchez was quiet for a long moment. Then, "Were you chasing ghosts?" "I was trying not to miss anyone else," Sarah said. "And that's why you corrected Colonel Ven," Sanchez said. "Not because you wanted to undermine authority, because you'd seen protocol fail, and you couldn't watch it fail again in front of recruits." "Yes," Sarah said. Hartford and Sanchez exchanged a glance, the kind of communication that happened between people who'd worked through this kind of situation before. "Your psychological evaluation recommended against active deployment," Sanchez said, "but it also recommended continued medical service in a controlled environment. Teaching seemed like an appropriate placement. What it hasn't accounted for is that you've been working under your actual expertise level for 8 years. You've been suppressing what you actually know because you were afraid of being seen as unstable. I'm not unstable." "I know," Sanchez said. "Hypervigilant people who care deeply about outcomes aren't unstable. They're people carrying the weight of things they couldn't control. And sometimes, when the conditions are right, when there's actual danger, they become the most valuable people in the room." She pulled a folder across the desk. "I'm recommending that your medical clearance be restored. Not for active deployment. I think civilian medical work is more appropriate for you, but the restrictions on your background, your training, your ability to work with advanced medical protocols, those should be removed. You've earned that." Sarah looked at the folder, then at Hartford, then back at Sanchez. "Colonel Ven?" she asked. Is being transferred, Hartford said. His decisions about the training protocols are under review. And for what it's worth, Captain, you didn't undermine him. You exposed a gap in his expertise. That's not insubordination. That's integrity. Chapter 5. The Weight of Truth. News of the investigation's conclusion moved through Fort Meridian Medical Training Center like a held breath finally released. Within 48 hours, everyone knew. Captain Chen's background was classified. Captain Chen had saved David Okonkwo's life. Captain Chen had been right, and Colonel Ven had been wrong. What surprised Sarah was the recruit response. They started appearing after her afternoon lectures, standing in the equipment room, asking questions she'd previously answered with textbook precision. Now they were asking for the real answers, the field answers, the experiences beneath the training protocols. Captain, you said heat exhaustion can present like parasitic infection, one recruit asked. What's the actual diagnostic difference? Did you really work in special operations? Another asked. Is that why you know field medicine? Why didn't anyone tell us you knew this stuff? Sarah answered their questions honestly. Not all of it. Some things were still classified. Some experiences weren't meant to be replayed for training purposes. But she stopped hiding. She stopped compartmentalizing her expertise into clinical descriptions that obscured the reality of field medicine. She taught them like they were going to go places where textbook protocols failed, because many of them would. She also visited David Okonkwo at his medical quarters 2 weeks after his discharge from the hospital. He was recovering well, mobile, alert, regaining the weight he'd lost during the acute infection. They sat in the hospital's observation garden, rain falling softly around them, hospital windows glowing like monitors in the distance. "Thank you," he said. And then, "I overheard some of the staff talking about your background, about Kandahar, about why you knew what I had. That's not information you needed. But it's true." Sarah watched the rain. "Yes." "Did you lose people?" he asked. "Is that why you push so hard?" She considered the question, considered the young recruit, someone whose life had just been measured in hours, in fluid retention, in the specific knowledge that almost didn't exist in this hospital on this day. "Yes," she said, "and I promised myself I wouldn't let that happen again. It made me obsessive. It also made me capable of recognizing when something was wrong with you, when the standard protocol wasn't enough." "So it was worth it," Okonkwo said. "The obsession, the hypervigilance, the classified background everyone was whispering about. It was worth it because it kept me alive." "Don't romanticize trauma," Sarah said gently. "It was worth it because you lived. That's all." But Okonkwo was already looking at her differently, the way recruits did when they realized their instructors weren't just delivering curriculum. They were carrying the weight of lessons learned in places the classroom couldn't access. That evening, Sarah sat in her apartment, small, orderly, the kind of space people built when they were good at disappearing. She opened her laptop and found a message from Dr. Patricia Mendez, the trauma surgeon from St. Helena General. "Captain Chen, I wanted to reach out personally. I looked into your background after the Okonkwo case. I learned about your service, about the colleague you lost, about why parasitic infection protocols matter so much to you. I want to offer you something. St. Helena General is expanding our trauma medicine program, and we're looking for consultants with field medicine expertise, real expertise, the kind that doesn't come from textbooks. If you're interested in working with us, part-time, civilian capacity, no military overhead, I think you'd be extraordinary. You'd have access to cases where unconventional diagnosis matters, and you'd be working somewhere that values what you know. Let me know." Dr. Mendez, Sarah read the message 3 times. Then she looked around her apartment. The precise arrangement, the careful distance from everything that mattered, the years of running disguised as routine. And she thought about David Okonkwo waking up, about the moment his vital signs had stabilized, about the fact that sometimes healing others was the only way to finally heal yourself. She sent a reply. Yes. Chapter 6. Redirection. 2 months later, Sarah had transitioned into a hybrid role: part-time instruction at Fort Meridian, part-time consulting at St. Helena General Hospital's Trauma Center. The contrast was instructive. At the training facility, she worked with recruits, teaching them the material, but now integrating the real-world expertise, the field knowledge, the kind of diagnostics that only came from having seen the worst conditions and lived to help others survive them. At the hospital, she worked with trauma surgeons and emergency medicine specialists, providing historical perspective on complications that didn't fit standard American disease profiles. She consulted on international cases, on unusual presentations, on the kind of medicine that required both textbook knowledge and the humility to understand that protocols were guidelines, not gospel. One afternoon, she was in the trauma bay, observing a case, a patient presenting with unusual metabolic indicators, elevated liver enzymes, neurological symptoms that weren't tracking with the standard presentation. She was watching Dr. Mendez move through the diagnostic tree, watching the careful process of elimination that characterized good emergency medicine. Then she heard Mendez say it. "We're missing something. This doesn't fit the protocol." The words hung in the air, the exact phrase Sarah had spoken to Colonel Venn months earlier. The phrase that had nearly destroyed her career. The phrase that had also saved David Okonkwo's life. Mendez looked at Sarah across the trauma bay. The question was wordless but clear. Sarah moved forward, gloved hands reaching for the patient chart, her mind already running through the differential diagnosis. Within 5 minutes, she'd walked Mendez through her hypothesis. Within an hour, they'd confirmed it. Parasitic infection from contaminated water during recent travel, the same kind that had almost killed Okonkwo. The patient survived. That evening, Mendez found Sarah cleaning equipment in the trauma bay, a habit she'd never lost from her training center days, the need to ensure everything was precisely organized, ready for the next emergency. "You should be in medicine full-time," Mendez said. "Not consulting, not splitting your time. You should be back in a medical program. Physician's assistant, emergency medicine specialist, something that lets you practice at the level you actually function." "I'm not sure I'm ready for that," Sarah said. "You're not sure you're worthy of it," Mendez corrected gently. "That's different, and it's the thing that keeps people with trauma from claiming the expertise they've earned." Sarah set down the surgical instrument she was holding. "Every time I've stepped into that kind of role, where I'm the one making the call, I carry the weight of the people who didn't survive. I carry that colleague from Kandahar. I carry every misdiagnosis, every protocol failure, every moment I wasn't enough. And every time you don't step into that role, you carry the weight of the people who could have been saved if you had," Mendez said. "You just saved a patient by recognizing a parasitic infection. That same condition will present again. It'll present to emergency medicine residents who won't recognize it. It'll present to trauma surgeons who don't know the presentation. And if you're not there, if you're not in a position where you're training the next generation, where you're consulting on the edge cases, then you're choosing to let that happen." Sarah thought about that, about the choice she'd made when she'd corrected Colonel Venn, about the choice that had forced her into the light, about the fact that hiding was just another kind of failure to use what she knew, what she'd survived, what she'd earned through loss and persistence. "I'll think about it," Sarah said. "If this story has already moved you, hit the like button. It helps more people discover stories of compassion and duty." Chapter 7. The next emergency. The call came at 02:47 in the morning. St. Helena General's Trauma Center was receiving multiple casualties from a transit accident. A commuter train had collided with a delivery truck at a grade crossing. Initial reports: 8 patients, varying degrees of trauma, 2 in critical condition. Sarah was off duty. Her phone had been set to alert only for her scheduled consulting hours. But somehow she was already awake. That particular hypervigilance that never quite went away, the part of her nervous system that still carried the anticipation of emergency. She made the drive in 18 minutes. The trauma bay was controlled chaos, the kind of organized frenzy that happened when a trained team moved through crisis. 4 bays active, surgeons and trauma specialists in coordinated motion, nurses calling vitals and medications, and the particulars of each patient's condition. Dr. Mendez saw Sarah and didn't hesitate. Trauma 2, crush injury, massive blunt force trauma, metabolic acidosis that doesn't match the injury pattern. We're missing something. Sarah moved to the bed. The patient was a woman, mid-60s, unconscious, her vital signs erratic and worsening, despite appropriate trauma intervention. Sarah read the chart quickly, looking for the detail that wasn't fitting, and there, buried in the intake notes, she found it. The patient had recently returned from Southeast Asia, volunteering work 3 weeks ago. She had a small laceration on her lower leg that had seemed minor at the time. Parasitic infection, Sarah said. She's developed disseminated parasitic complications from a wound sustained 3 weeks ago. The crush injury is masking acute systemic infection. Mendez didn't hesitate. Get me anti-parasitic meds, now. Within 2 hours, the correct treatment protocol had been started. Within 4 hours, the patient's metabolic indicators had begun to stabilize. By dawn, she was conscious. By midday, she was stable enough for surgical repair of the crush injuries. The medical residents who'd watched the case unfold were clustered in the observation area when it was over. One of them approached Sarah as she was leaving the trauma bay. "How did you know?" the resident asked. "We all saw the crush injury. We were treating the obvious trauma. How did you know to look for something else?" "Because I've seen parasitic infections present atypically in trauma situations," Sarah said. "And because I've learned that the protocols don't always account for the full picture. You'll learn that too. It's part of becoming good at emergency medicine, knowing when to follow the textbook and when to trust that something else is wrong." The resident, a young woman, maybe late 20s, with the particular intensity of someone who cared deeply about getting it right, was quiet for a moment. Then, "Were you in the military?" "Yes." "Is that where you learned this?" "That's where I survived learning this," Sarah said. "There's a difference." That afternoon, Sarah sat in Dr. Mendez's office. The hospital's director of trauma services, Dr. Robert Chen, no relation, one of the small ironies of life, was present. They'd been waiting for her. "We want to offer you a position," Dr. Chen said, "Director of Field Medicine Consultation. You'd design protocols for international cases, train residents on non-standard presentations, coordinate with infectious disease specialists on complicated diagnoses, full-time, benefits, research opportunities. You'd be teaching at your actual expertise level." Sarah thought about the night she'd corrected Colonel Venn, thought about the moment she'd chosen visibility over safety, thought about the cascade of consequences, exposure, investigation, vindication, and finally this, an offer to step fully into the thing she'd been hiding from for years. "I'll take it," she said. Chapter 8. The Burden of Memory. The transition to full-time medicine happened quickly. Within a month, Sarah had moved out of her small apartment and into a larger house near the hospital, a place with windows that let in light, rooms dedicated to work and thought, space that didn't feel like disappearing. She developed training protocols for residents, introducing them to the diagnostics of field medicine, the way parasitic infections and environmental complications presented differently in trauma situations. She consulted on complex cases, brought her expertise to rounds, began writing papers on non-standard presentations of tropical disease in emergency medicine, and she started finally to talk about her service. It began with a resident named James Park, a young doctor who'd shown particular aptitude for field medicine protocol and had asked directly if Sarah would share her experiences. They met over coffee, and Sarah found herself talking about Kandahar for the first time in years. Not the classified operations details, those remained protected, but the human reality of working in a theater where parasitic infection was endemic, where the difference between textbook protocol and real-world adaptation determined survival. She talked about the colleagues she'd lost, about the specific combination of symptoms that had been missed, the diagnosis that came too late, about the weight of that failure, the way it had nearly broken her, the way it had also shaped everything she became. "Why didn't you pursue this earlier?" Park asked. "Why wait until now?" "Because I was afraid," Sarah said. "Afraid of being seen as unstable, afraid of being fixated on trauma. Afraid that stepping into medicine at that level would make me unable to separate what happened from what I could do, and mostly afraid that I'd fail again, and that failure would cost someone their life." "Has that happened?" "Not yet," Sarah said, "but I think I've finally accepted that it might. That failure is part of medicine. That hypervigilance isn't a flaw if it's coupled with accuracy. That carrying the weight of what you couldn't save doesn't disqualify you from saving the next person." Word spread through the hospital. The trauma director, everyone consulted on edge cases. The woman with classified military background who could diagnose the things that didn't fit standard protocols. The healer who'd been hiding and finally wasn't. Then, 3 months into her new position, Sarah received a visitor. David Okonkwo appeared in her office one afternoon, no longer a recruit, now a second lieutenant, stationed at a deployment preparation facility. He was healthy, recovered completely, his eyes carrying the particular clarity of someone who'd been close to death and had learned to appreciate the precision of living. "I wanted to thank you," he said, "not just for the diagnosis, but for everything that came after, for being honest about why you knew what you knew, for teaching the next cohort of trainees that protocol isn't law, that expertise matters, that sometimes you have to risk visible judgment to save someone's life." "How's your training going?" Sarah asked. "Better," Okonkwo said. "And I'm going to be careful. I'm going to stay alert to the things textbooks don't teach. I'm going to carry what you taught me about medicine into whatever theater I end up in. And if I end up somewhere, I wouldn't have survived without that knowledge." He stopped, restarted. "I'm going to remember that a woman with invisible scars gave me those tools because she cared more about my life than about her own safety." After Okonkwo left, Sarah sat in her office for a long time. The walls were now lined with medical journals, field medicine references, case studies from international deployments. This office, this role, this life, it had only become possible because she'd chosen to be visible, because she'd corrected a deputy director in front of recruits, because she'd let the weight of what she carried become evidence rather than a reason to hide. That evening, she visited her colleague's grave for the first time in 4 years. Private First Class Maria Reyes, 2003-2011. Daughter, sister, medic. Sarah placed flowers on the grave and sat for a long while in the quiet. She didn't ask for forgiveness anymore. The diagnosis that had been missed wasn't her failure. It was a systemic gap, a moment where medicine wasn't enough. A tragedy that had nothing to do with Sarah's worth or capability, but she could honor it. She could make that gap smaller for the next generation. She could teach the protocols that would catch parasitic infection before it became critical. She could train residents to think beyond textbooks, to listen to their instincts, to value expertise over comfort. That was redemption, not absolution, but continuity. A way of saying, you mattered, your life meant something, and I'm going to make sure no one else ends up like you, if I can help it. Chapter 9. The Quiet. After 1 year, after she'd first corrected Colonel Venn, Sarah stood in St. Helena General's Trauma Bay, observing a surgical team work through a complicated case. The patient was recovering from a parasitic infection that would have killed her a year ago, would have been missed, would have been classified as complications from the primary injury until it was too late. The resident leading the case was James Park. He'd taken her protocols, integrated them into his decision-making, and now he was teaching the next rotation of trauma residents. The knowledge was dispersing. The gap was closing. The invisible expertise was becoming visible, becoming standard, becoming the next generation's textbook. Sarah's phone buzzed. An email from Dr. Mendez, forwarded from Colonel Hartford at Fort Meridian Medical Training Center. Captain Chen, I'm retiring next month. Before I do, I wanted to write this down. A year ago, you made a choice to correct authority in front of recruits, to risk your career for what you believed was right. It was the right choice. That choice led to David Okonkwo's life, to the exposure of systemic gaps in our protocols, to your own restoration, to the level of expertise you'd earned and suppressed. I'm writing to tell you that sometimes integrity looks like insubordination at first, and sometimes the people with scars are the people most capable of leading. I'm grateful I lived long enough to see what became of you. Colonel Hartford. Sarah read the message 3 times. Then she closed her email and returned her attention to the trauma bay, where James Park was guiding a younger resident through the diagnostic criteria for parasitic infection, where a patient was recovering who would have been lost, where the protocols Sarah had fought for were becoming standard, becoming the next story, becoming proof that speaking truth under pressure wasn't a failure, it was the beginning. In the observation window, the fluorescent lights hummed their eternal 3 a.m. song, even though it was 3:47 p.m. Sarah had learned to hear that sound differently now, not as invasive. As the quiet rhythm beneath everything, beneath emergency, beneath trauma, beneath the moment-to-moment choice to stay present and use what you'd survived. The monitors beeped. The surgical team moved with precision. The patient's vital signs held steady, and in that steady signal, Sarah finally heard what she'd been looking for all those years, the sound of someone living because someone else had been brave enough to say what mattered, to correct what was wrong, to let the weight of what she carried become evidence rather than a reason to hide. Epilogue. In hospitals, as in war, courage rarely looks like heroics. It looks like someone who knows what the protocols miss, who speaks when silence is safer, and who carries invisible scars so quietly that only another healer recognizes them. Sarah Chen became a healer not despite her trauma, but because of her unwillingness to let what she'd survived be wasted. And that's where the real redemption lives. Not in forgetting what was lost, but in preventing anyone else from having to bear that same loss. Subscribe for more stories of courage, healing, and redemption. Thank you for watching the case of She Corrected the Deputy Director in Front of Recruits. What happened next, when lives were on the line, changed everything. See you in the next one.